things in my life, and I appreciate it.
And I appreciate you too, man. You know, like I said, I always try to express my appreciation, to everybody. It's a lot of people that have
perspective. Real empowerment, you better be respected. Lady Fresh on the motherfucking check-in. Weezy got her back, she stay protected. Just the fresh perspective. Real empowerment, you better be respected. This for the dreamers, it's to get you through the night now. Not for the haters, bet you they don't come outside.
Lady Fresh Brown.
Series, the Autism Awareness Series. This is part 3. Hopefully you guys got a chance to tune in to parts 1 and parts 2. Part 1, we had our psychotherapist, Miss Jen Slayton. She was a licensed clinical social worker, and she gave us the perspective from a psychotherapist and talked about actually diagnosing autism and some ways to identify autistic traits in children and in adults. We talked a lot about things that we may be overlooking, some of the common misconceptions. And then we did part 2 with Miss Callie and Dr. Emmy. That was another wonderful episode. Those ladies came and they spoke on the parent perspective. And they talked about raising children with autism. Miss Callie has a younger child that was just diagnosed about 30 days ago. So we got her perspective as a new parent and some of the frustrations that she's facing. And Dr. Emmy, while she is a doctor, didn't speak from the doctor's perspective. However, she spoke as a parent who has raised a successful adult. He is now 23, fully functioning. He's out of the home. He's in college, preparing to graduate. And she was able to give a lot of perspective on, raising a child that's highly functioning, some of the common misconceptions from a parent perspective, and also, give Miss Callie and other viewers who may not know where to turn once they get the diagnosis. They were able to really dialogue with one another and with the chat and really explain a lot of things that we may not understand from the parent's perspective. So it was Elizabeth Rose here, and we're going to talk a little bit about the therapist perspective. So Elizabeth, I'm going to hand you and have you talk to us a little bit about yourself. Tell us, who you are and how you got into becoming a licensed creative art therapist. Did I say it right?
Yes, you did. You got it. All right. So, hi, everybody. I'm happy to be here. Glad you guys are tuning in. As you guys, as I explain, like what I do, if you guys have questions, I'll try my best to answer as we go, but we'll have some questions at the end. But just to start, I am a New York State licensed creative arts therapist. So I got into art therapy, I guess. I didn't know what it was until I went to college, like right after high school, when you graduated, and they're like, oh, what do you want to do? And I was like, I don't know. But I was always interested in art from a young age, from as young as I can remember, from like kindergarten. And then I participated in a bunch of artistic things, and I liked science. And then just growing up, like I realized that people would vent to me or like would speak to me about like issues and concerns, and I was always that friend to like be a listening ear. So once someone shared with me like art therapy, do you know about that? I was like, no, like what is it? So I figured out that it was a career that I could go into. So I did going into college. I decided to double major in psychology and studio art. And then that's what helped me to decide going after graduating 4 years at Franklin and Marshall College. When I came back to New York, I looked at Pratt Institute, and I attended Pratt for 2 years and got my master's in creative arts therapy. Creative arts therapy, it's a mental health field, a licensed mental health field where you need to have a master's degree and a license in order to practice. So the goal of it is it's an expressive means to help people overcome different things. So like emotional concerns, mental health concerns through a creative process, right? So some of the 4 disciplines, and I've worked with different therapists in each of these realms, One is an art therapist, which is what I do. So it would be with a licensed art therapist, and it varies from state to state. I'm licensed in New York State. And that includes doing like studio art, drawing, painting, sculpture, photography. And it's to help someone develop like emotional awareness, self-esteem, helping with like intellectual disabilities, or helping someone express themselves. Because sometimes, and I know even me, everybody, there's just sometimes where you feel something and you can't put it into words. That's what the creative arts will help you do, to help you process that. Do not just like psychotherapy, because creative arts therapy, especially in art therapy, we are psychotherapists, but what's awesome is that we're able to have a nonverbal way of processing. So psychotherapy is talk therapy, but in art, we have a nonverbal way to help you process that. So that's what an art therapist does. Then there's dance therapy. So it's using movement and dance to help support the emotional development and awareness and healing. Then the same thing with music. So I know I've seen videos. You guys probably seen it too. Like there's some people who might have an intellectual disability. They might be on the spectrum or whatever the case may be, and they are geniuses at playing the piano or like some type of music. But people, that's just their language, right? So music might be a way for them to help relieve stress or promote expression and emotional healing. And then there's drama, right? All of our actors out there, you see some kids who are just like, they're killing it, like it's natural, right? Some kids, they might be more introverted, but if you put them in a drama environment, they're killing it. You can see like they're the whole like opposite of when you see them in their not true introverted state. So drama therapy is like theater, using that for emotional expression and healing as well.
Wow. So it covers basically all of the different forms of arts, whether it be performing arts
Mhm.
or, written drawing, things like that. So is there one area more than others that might be a little bit more popular? Like, do your kids tend to rear more towards the art portion or the music portion, or is it pretty even all the way across?
If that's an interesting question. I can't give like one answer and it's completely correct. From my experience, I would say like our natural tendency is to start with art, like at a young age, right? We like scribble, like we're into like water and like play. Like a lot of that has to do with some expression through like arts and stuff. So I would say art is might be like an initial like way of getting into it. But I guess it depends on the child, right? So it depends on how they interact. Maybe art is more suitable for a child based on their interests or what you see, what you can observe that they like to do. Dance might be music or drama, right? So it really depends. But I would say maybe art, because everyone from a young developmental stage goes into art. So yeah.
So tell us a little bit about how art therapy specifically um,
Mhm.
can help with autism in children, and then if you could tell us also how it can help with adults.
Of course. So I can start from my experience in my first internship in grad school, where I worked with toddlers. So there I was working with two types of classes. So one was a class where I had like 6 to 8 children who were on the spectrum, all different abilities, different sensory or auditory stimulations were very different. And then I worked with a class that had like, it was called an inclusion class. So that would, in New York public schools, might be like a special ed type of class where there's like different kids on different levels. So there might be some kids who are like on a typical, like normal type of education path, or and then some they might have IEPs or individual education plans. So with my class that I had with the children who are on the spectrum, um, we had like a routine. I had, and even with the other class, but like a routine was very important. And you can see from the beginning of the school year to like mid school year, end of the school year, just like how the kids come in. Of course, is if it's they're new, right? Developing a routine and getting used to it, it takes some time. But you can see like a lot of it was like the routines, like you come in, sit down, we're saying hi and make sure that we're aware of everyone who's in the room before we go into um, an activity. So it's really about just like having like a way to engage them initially and just a check-in with them, and encouraging them to be like self-aware and express themselves, because that's what a lot of concern was, where like they, you know, communication, right? It's hard for us normally to communicate, especially for children with autism. It, you know, it takes a little bit more time and more support. So that was very important to do that. And then there is different teachers that I had in the classroom for support. So it takes a village, just have to say, even though I was the therapist and like maybe the expert in the room with art and whatnot, had to be able to delegate and like let the teachers know, like, do this, do that. So like it took a village to be able to support each child. And then some children needed more support than others. So and then like with adults, it was very different. Like in my experience as a recovery counselor and art therapist, working with adults, you can see more of like the social aspect, like how they might struggle to like be socially engaged in a group, or just like comments and whatnot. So it's like learning how to redirect them into a conversation or how to include them in a conversation in a group. So at least with the adults that I work with who were on the spectrum, they had already developed a lot of the skills that through like other therapies and with other like therapists. But even though like in a social group or in the art therapy group, it was still very difficult and they needed some direction or redirection. So not as much support as you have to do like hands on hand, like taking a child's hand, like let's do this, let's learn how to hold something. Um, Still do that kind of with adults if you're introducing new materials, but it's more of like the social engagement and getting them involved and engaged and expressive that way.
So I know you do a lot of work within like the public school system, right?
Yeah.
Right. And so we're going to get into that, but so do you do the majority of your art therapy? Is it more of a group setting, or are there instances where you're working with one child at a time?
So it's primarily group art therapy. However, if there was like a child who needed individual support, I've done individual. To this day, like I wish I could just see him like every day. But I worked with him because he was nonverbal. Eye contact. He wasn't making eye contact. He wasn't, speaking. Not really aware. Be like isolated, wouldn't engage. So I worked with him one on one to help him start to speak and develop language and to be self aware and like engage with like classmates and whatnot. And over time, he started to he started to speak. He said my name, and at the beginning of the year, there was like nothing, like the eye contact, like I had to like verbally say everything and just like kind of be like close in his face. And like I said, I might mention like hand over hand. So it's just like, um, holding a child's hand and just like, okay, now we're going to do this, time to do this. So you have to like verbalize everything. And I had to, there might have been like one art activity that I've done like 10 times in a row, maybe. And that's because that was just to get him in a routine to see like if he knows like what the steps are. And eventually that worked. And like once you see some progress there, then you can move on to the next like plan. So yeah, that's how it was like when I was working with like an individual toddler. With adults, it's a little bit different. It was just like self-expression. And that one was like more of like an open studio. And when I say open studio, meaning like I can introduce whatever materials and they can choose what they want to do, or I can give options, because options is very important, because what I noticed in like the adult that I worked with in the individual session, he had a hard time making decisions. So had to narrow it down to like this or this based on what I know that he likes or engages with. So having options is very important. But over time, if they can progress past options, then you can have like introduce more materials without, setting a certain type of like materials out.
Okay. And so you have to have a pretty set plan as to how you're going to work with the kids before they even arrive, and then you customize according to the child.
Yeah, so it would be like we would call it a treatment plan, right? So even though you might think like, oh, it's art, like how is it treatment? It is important to note like all artwork is clinical documentation. So I was thinking like when you asked me to come on the show, I was like, oh man, I have like images because I've done a presentation about the child that I'm speaking of, but I don't have permission from parents as a while ago, and it is confidential. So you can't just show like artwork because it is clinical documentation. So it's important to have a
Okay.
treatment plan, and there's certain materials that you introduce at a certain time to help induce like language, for example. So like um, fluid materials like paint, so like dealing with water, those materials are known to help encourage language. So that was a goal that we worked to, but there were like some things that we needed to focus on, like sensory motor, hand-eye coordination before we got to that part.
Things. What
Mhm,
is it like when you receive a new child into your program that may have a lot of issues with meltdowns? What are some of the techniques that you might use for a child that experiences things like that, especially if it's like separation? I know, some kids have separation issues just because they don't like to be away from their parents, but I'm assuming that it can be magnified sometimes with a child that has autism. What
mhm,
kind of techniques may you use to try to get that child calm and comfortable enough to proceed with the lesson?
mhm. Well, from what initially comes to my mind is working with the parent. The parent is with the child always, right? So you might have a child who, they come into therapy for a certain behavioral concern, right? The best thing to do during like an intake, so that initial meeting of like sharing what you want the therapy to be for, to give as much information as possible because we don't know the child, right? If there was like other therapists, right? So we consider notes from like other therapists and we collaborate with other therapists. So we get that information from the parent, and then we'll take that to help decide what the sessions will look like, right? But also consider what transitioning routines are in place, right? So if a child is melting down, it's triggered by something, right? So to understand how a child is supported during the transition, and what can be implemented to help them during the transition or during a behavioral crisis. It's important to collaborate with the parent, other notes, and just observation over time because it's not going to be like I see this one time, bang, I know it up, I know what I'm going to do because it varies, right? Our mood varies normally, so we just have to observe and understand like patterns, and then go from there.
Have you seen a lot of progress with art therapy?
Um, yes, so both in working with the individual and in groups, right? Because we have to take into account like group dynamics. If you guys ever heard the term, it's just like um, learning how people within a group interact. And it comes up in hand comes with like awareness. So it's to be self-aware, right? And then to be aware of everyone else in the group, right? So if you're talking about like with artwork, for example, everyone has like their individual work that they're working on. But at the end, at the end of all sessions, there's a time where we break out and everyone's sharing, right? So some people initially when you first join a group, they might not want to share, and over time you'll start to see people get comfortable and start sharing. A lot of people in art, they think that you have to be like Picasso or it needs to look a certain way. That is not the purpose of doing art and creating art, especially in the art therapy environment. It is supposed to be healing, right? And there is a directive. So sometimes there's like some groups with open studio where you can use any materials and just, you know, create artwork from free expression. Or we have directives where there's like a topic and you would create art based on that with certain materials. But overall, it's supposed to be healing. And if you feel comfortable, you can share it with everyone. So it's just to be self-aware and learning, basically like teaching people to be like socially comfortable and speaking about how they're feeling.
I love
Um,
that.
yeah.
I love that. It's a safe space. You and I were having a discussion, and we talked about what you did for a living and how you're highly educated in this field of art therapy and how you're of service to so many people in need. And we started to kind of hone in specifically on autistic people and children and being in the public schools. Why do you think it is that um, a lot of people have never even heard of art therapy? They heard of the arts, they
Mm-hmm.
know it's in schools, but art therapy as a form of treatment and management, why do you think a lot of people aren't aware of this?
There's a few answers to that. One is art therapy is actually still a growing field and a growing profession. So a lot of people, they don't know about it. They just know about like social work or like a mental health counselor. So the creative arts therapies is like a new field that is growing. But you can what's happening is that also it depends on state to state, the licensing and noticing it and acknowledging the creative arts therapies as a mental health field and a profession. A lot of people don't respect it, or they just think like, oh, that's art. I can put art in my sessions, right? So like there's a misconception or misclassification of what the creative arts is. Some people, they misclassify the creative arts as like recreation therapy. And while creative arts therapists can do recreation therapy, it is a mental health profession, right? Recreation therapists, I think that their goal is to like manage like extracurricular activities like at like community centers and whatnot. And art therapists can do that. But we are psychotherapists, we are social workers, but we also have the addition of nonverbal communication, and we are licensed and trained to be able to recognize certain behaviors, certain materials, certain techniques, certain assessments to help someone to be able to, be more expressive and aware and heal from different things.
Right. And you, when you and I had this discussion, I had a little bit of outrage because when you broke it down to me, the way that you're breaking it down for everyone today, it sounds just as vital as any other
Mm-hmm,
type of psychotherapy or therapy that's utilized to help people in the mental health you know, spectrums. It
mm-hmm,
sounds crucial, it sounds vital. And you mentioned something very important, which is that the arts, it's not respected. And I think sometimes it's not respected overall, even not just in therapy, but specifically within therapy. They look at it like extracurricular, or they can just do it themselves, or they can give their kid a piece of paper and let them draw. That's not art therapy. That you need an actual therapist to kind of help guide you through how to do this properly. And there's a
mm-hmm,
structure in which I've learned through this series, part one and part two,
mm-hmm,
that people on the autistic spectrum, they need structure. Like they like to have a routine. They may have not started that way, but things like psychotherapy and art therapy by licensed professionals aid in that. So the fact that the arts aren't respected, like, to me, that's crazy. So how do you, being that it's not looked at the same as other types of mental health therapy, how do you get your work?
So for me, my experience has been at in clinical settings that are welcome, and they really acknowledge and know that the creative arts therapy does help with like certain populations. So like I said, like when I worked with the toddlers, it was a day treatment school. So it was a treatment school where if your children might be on the autism spectrum, they might have behavioral concerns, they might have intellectual disabilities. There was a school specifically for that, so they know that occupational therapists, dance therapists, music therapists, art therapists, in order for children to develop, right, they go through those creative processes and nonverbal communication in order to help them develop the skills that they need. So it is recognized at like treatment facilities that the creative therapies is a vital part of like a treatment for the emotional healing, skill development, and just expression for a lot of populations. Um, and I think what's hard is that it's narrowed down to like these little areas or like facilities, but there's a general public that needs it. It's not just people who have like intellectual disabilities or who might be on the spectrum. Anybody can benefit from it. And it's kind of hard to like share that if it's only seen beneficial in these small groups. So like with the adults, I worked in a recovery oriented clinical setting, right? So they know that we need an art therapist, we need a drama therapist and music therapist, right? But when you go to like other, facilities, it's not seen because maybe psychotherapy is the way, social work, but that's just not it. That's not the only thing, right? So
Right.
I think now because it's a growing field, and that's because more and more people are learning about it. However, they learn about it, maybe it's like instances like this, or they come across someone that they know who is receiving, and it's like, oh, you know what? No, my child does this, and they hang out. This might be beneficial for them. But the thing is, if that happens, they might not have like environment or facility to support that. In addition to um, health insurance, it's hard
And
to
there it
try.
is.
It's hard to try and seek services for creative arts therapies because health insurance, they do not recognize the creative arts therapy as a mental health service. So a lot of the times, private practitioners and private practice um, is self pay, and so while
Right.
some people who have the funds, they're able to self pay, they can receive it. But and the reason why I wanted to get into art therapy is because I'm from Harlem, everybody, and I
Ooh, Harlem
I
girl.
am. Let's go. I enjoy working and I want to give back to a community where I came from, so underserved communities. However, unless it's like those specific groups, like I said, like the treatment centers, like if they have like Medicaid or like whatnot, there's certain programs that I think fits under it, but I don't understand the billing completely. But to bill to receive like a creative arts service is not through creative arts; it's through something else. So that's why it's also very hard to seek the services because health insurance doesn't see creative arts therapy as a service. It has to be given through another name, which doesn't help because it is vital. It's just important as whatever that title that creative arts therapy is given under is just as important.
And
And
that's
there's a
exactly what I wanted you to mention, the fact that health insurance doesn't cover art therapy, y'all. It's therapy. It's necessary. It's needed. So what ends up happening is our underserved communities aren't receiving a very vital and beneficial resource to aid in whatever it may be that it's needed for, because insurance doesn't cover it. It has to be self-pay. And these art therapists, such as, how rewarding is it for you?
Oh man, it's challenging, right? And nothing is easy, right? As a therapist, number one, right? You have like different personalities, different things you have to deal with, but over time, like for me, like I'm not the type of I love like the process of things. And that's what's important about art therapy. It's about the process. It's not about the product, right? So although I say that not to say that we don't have goals, because right, every you work toward a goal, but it's not solely about that goal, just like A and B, right? It's about the process,
Mm,
what happens, the development, the character development,
the
right? We see
collective.
this in shows, we see this in plays, right? What builds upon a character? What skills can you gain? And it's amazing to see someone progress from like very difficult struggling, and you just like being patient and persistent and consistent. And over time, like it is rewarding. Like if you work toward a goal, you might have to try it this way. It doesn't work. Oh, I'm okay. I noticed that, right? You have to be very observant. And just take your time. Trust the process. Believe in the process, because over time it will happen. And I definitely heard that in the last episode with
Like,
the
because I'm assuming a lot of therapists, psychotherapists or other type of therapists bring you guys in.
Mhm.
So what kind of conversation do you have with parents, like during intake or, first meeting or consultation, um, as far as like managing expectations and what to expect from your service?
Mhm. Yeah, that's a good question, because it varies depending on what people like the abilities. So everybody has like different concerns, different goals, right? So like I was saying before, is to get as much information as possible. So like the reason why you're seeking therapy, what are the main concerns right now? What is the goal? Like just life skills. Like what are the essential life skills that they are struggling with and they need help with, right? Those are the things that we need to know, and that's how we formulate our treatment plans. And then from there, it's an ongoing conversation, right? So you have to constantly collaborate with the parent. It's like, okay, we started doing this in therapy. If it's kind of like giving homework in a way, but it's creative homework, it's engaging homework, and the parent has to be well, it's more helpful if the parent is engaged and does things that the therapist suggests, because what the child does at home or what the child does at therapy, if they do it in both environments, it'll help progress, um, help them progress to reach the goal or develop the skills that they need. So it's really just like understanding where the client comes from, what they're capable of doing, and what their main concerns is, in an ongoing conversation to help them reach a certain goal.
It takes a community.
Hmm.
It takes a village. Basically, you need that support, communication. I really, honestly, I'm amazed at what you do. The outrage of how you explained about the arts not being respected. I wasn't familiar with art therapy until we had that conversation, first of all.
Mm-hmm.
And I was so amazed with what you do that I was like, oh, that's awesome. She should be killer at this. And, I'm sure that she's probably getting calls left and right. And you probably still do. However, I feel like it's almost unfair. Whenever we want to do something that pours into ourselves and pours into our community, it seems like it's always a way to undercut it, no matter what
Mm-hmm.
it is. You know what I mean? They don't, it's, and I'm hoping that changes. I'm hoping that at some point you guys um are recognized the way that you deserve to be recognized, because I can only imagine nothing but good can come from this.
Mm-hmm.
Has your experience with parents been like oh my God, I see such a huge difference. This really has been a game changer for him. He's communicating more, or, he's calm more. Like, what have been some of the feedback that you've gotten?
Feedback from parents, feedback from teachers, feedback from like staff. It's like the whole community, right? Because a child isn't just seen by like the therapist and the parent, it's interaction, right? So a lot of the goals for anyone who's getting therapy, a lot of it is because they have issues or trouble or struggles interacting with the environment and people, or being self-expressive, right? Or recognizing certain things. So yeah, definitely. Like I said, with the toddler, I think he was 3 at the time, 3, 4. From not making eye contact to coming in the room directly looking at me,
Mhm.
saying my name, like I was so happy, Like, and that was me. I only saw him like once a week. So imagine if he's doing this with me, like at home and in class, you can see you starting to like share with like some of his classmates, like looking, turning, right? Because at first it's just like not making eye contact, maybe just busy with whatever's in front of him, but now they're like more self-aware of their environment. So it is lovely to see after like it is hard work. So I'm going to say after all the hard work and the persistence that's put in, um, think parents they want their child to be successful. So whatever it is, if they can do anything, always voice that and communicate. And everything, like their feedback, their questions, their concerns is always welcome. So it wasn't like, no, they're parent teachers, this is our only conversation. It was just like if they came to the school, or like they could email or phone call or something, like it was just a consistent like back and forth.
As far as people who might want to look up resources that could help their autistic child at home,
Hmm.
even if it's like, things they can do at home, or resources to find an art therapist,
Hmm.
what would be your recommendations for people who, are outside of New York? Because we're going to tell them come to Liz if they're in New York. But
All
if they're
right,
outside
so
New York, what would they do?
so if you could pull the slides up because I have some things there that I want to point out and highlight. So right here, so I just want to go over like best practices. So some things based on like studies to note and be mindful of. This is right on the internet. I try my best to put things in that you guys can go and look at for yourself. It is an organization that works with autistic population, and they just highlight that some of the best practices in working with individuals with autism is to have a routine. So, in their practice, at the beginning of each session, there's some structure to support like the having a routine, and I've done that as well. You have to be very you have to communicate the whole time, like no matter what it is, even if you think they're not listening, you have to voice what it is they're doing. It's like, okay, like now it's time for this. We're going to do this. Oh, it's time, and you have to be enthusiastic. You don't want to be like overly directive. You don't say, okay, like go and do this. You have to like try and get them to engage, encourage them to make a move, and if they don't, then you can help model that for them and help them. And you just want to give instructions by helping them do things. And then eventually, over time, just encourage them to do it themselves. So, a part of that comes with just like routines, transitioning, being very clear with that. I mentioned transitions. So, someone is having a meltdown, right? Maybe a child, they really enjoy something that you were doing, and unless you have a routine to transition, they're going to have a meltdown, right?
Mm.
So, I was, if we're going back to the first session with Jen and the question about the school bus, right? Um, I had posted a question on behalf of my sister in law, who is a school bus driver. And she told me, like, after the conversation, it was just like, I noticed he only has a meltdown when the bus stops or parks. So I was like, oh my gosh, like, that's good information. He's not just like screaming for nothing or like a meltdown for nothing, it's probably because he's enjoying that car that ride. And when the bus abruptly stops, that's a disruption in his joy. And unless there's a transition or support to help him become aware of that and develop some coping skill during that time, you're going to see a meltdown, right? So it's just like noticing certain things, having a routine. And if you notice like a transition where there's a behavioral concern, you got to work on it and like figure out some type of support to help the child in that moment.
Okay, that's very good information to know.
Mm-hmm.
So I got a couple
Yeah.
questions coming in. Did you have something else to add before I start?
I mean, I can take some questions and then go to the next one afterward.
Okay. So Lotus asked, what was her first experience she remembers that was the most challenging and made her rethink her career choice, if she has had any of those experiences? That's a
That
good
is
question,
a good
Lotus.
question. Oh man, okay. There is a term. Why am I forgetting it? Oh my gosh, there's a term. So basically, as a new therapist or imposter syndrome. I think a lot of people imposter syndrome.
Got it. Okay.
So, and I'll speak for myself, but maybe somebody might relate to this. It's like when you're new in a certain situation, and it can be very overwhelming. And sometimes you think like, oh my gosh, why am I here? Like I'm not smart enough. Like I don't know all these things. That happens. Like you feel like you don't know anything. You feel like because you're thrown into a certain situation, you don't yet have the answer for it, that you're a bad therapist or you're a bad person. Right? This has happened because like maybe you had a plan, right? I had a plan, or I had a type of routine, but something happened and I didn't know how to manage it, and that can be very overwhelming. But it comes with experience, right? So yes, I don't remember a particular experience, just to answer your question, but it comes and goes. Especially when I first got into art therapy and took my first job, I was like, oh my gosh, I'm working with adults. How do I do this? And me, people still think I'm like 19, 20. I'm only 5'3". I'm not in my 20s. A lot of people still think I'm in my 20s, and I get misjudged. So it's just like, oh my gosh, like should I even be in this environment, because people are not even respecting me just how my appearance, right? So then when I start to speak and I have to do like this type of work with them, are they going to even respect me?
I've experienced that myself.
Stuff like that.
I think that happens especially a lot amongst minorities. I feel like that happens a lot with women. I can only speak from a minority woman, but I feel like it happens a lot because sometimes you feel like, dang, do I know enough to be in this room? Like, especially if it's new. I know when I first got into hair transplant surgeries, I'm working with patients who have to walk around with their heads looking like this forever. And so in the beginning, it was like, oh my God, what if they ask me a question and I have to start fumbling around and answer? You basically start doubting yourself, as if maybe you shouldn't even be doing this. But I think, and the advice that I could give to you with that is, the longer you're doing it, the more comfortable you're going to be. And you will still feel that every now and again. When I pick up a new client, a new doctor's office that I'm working for, I'm like, okay, I'll text Fresh and be like, oh my God, I'm very nervous. I don't know why I'm so nervous about this new doctor's office. He'd be like, girl, if you don't stop, everything. Stop doubting yourself. You're going to be okay. And I need that. Like sometimes you kind of need that little bit of reassurance that you're going to be good. So I think you'll feel that less and less the more and more that you're doing it. But I think it's awesome that you made mention of that. You didn't necessarily have one experience that made you feel like that, but it was the self-doubt. And I didn't know it was a name for it.
Imposter
You said
syndrome.
imposter syndrome. So you think of yourself as the imposter.
Mm-hmm.
Yeah. Okay. Now
Yep.
I know. Now I can tell. I can tell Fresh the next time I text him. I got imposter syndrome, bruh.
Yeah, that's a good question. I see a question in the chat. How would you handle a conversation with a parent who
I
doesn't
think that was
know,
probably lower down. I
who's
didn't get.
unaware that their child is on a spectrum? Um, that's a good question. Um, I mean, my thought going is, are you a professional like a teacher? And if so, I just like the easy answer is the longer you are with a child, or especially in a group environment, there might be certain traits or characteristics or like behavioral patterns that you recognize. If you do notice that they follow a certain pattern that might be identified as someone who's on the spectrum, um, to navigate a conversation with someone who might not be open to that conversation, that is a struggle, right? But you can start off just like, hey, like I know so and so isn't able to or struggles with this. Have you thought of doing this, or have you spoke to the doctor about this or something? Because there is developmental milestones that everybody at a certain age should hit, or in grade levels or social skills or whatever skills it is. And if you notice that a child is behind in that, then you can recommend or like send referrals, like resources, like, hey, I noticed this. If you take a look at this might be beneficial. So,
All right.
and
Hopefully that answered your question.
yeah.
Yeah. I suspect that I'm related to that person that asked that question. Rich Martinez asked Lady Fresh, please ask her what she feels about kids being homeschooled versus building schooled with autism. So home versus being on site.
Just like education.
Yeah, I guess as it. What are your thoughts on a child with autism being schooled at home versus being schooled in a normal school setting?
Nothing wrong with it, right? Because maybe like being one-on-one might help a child like develop certain skills before they go into environment, because it is easier, just like in typical development, right? Yeah, maybe children are expected to know a certain amount of things or develop skills and one thing before they go to school. It's the same thing, right? Maybe if a child needs more support and stuff, if you can be very hands-on, that's very important. So if a child is at home, you need to have like a strict routine, understand transitions, like helping them adapt to things and introducing things that they might come across in an environment with other kids. You can be super hands-on and plan something and do things that helps them with that. Nothing wrong with that. However, because a lot of people with autism, they struggle socially, that it's very important that they need to be in a social environment. So there's nothing wrong with being homeschooled unless they're like around other kids who like in a small group, but it's not enough for them to just be individual all the time. Maybe if there's like an after school, like maybe if they're homeschooled, fine, but they have some type of after school curricular activity that they are going to be and socialize around other kids. Because that's just our nature. Like you have to be around people in the world,
Well, would you say that something like the pandemic, when the pandemic hit, do you think that may have caused a lot of what's the word I'm looking for? Being that they need a system and they need a structured way of doing things. If we've gotten them on the pattern of getting up, going to school every day, working with these teachers, riding the school bus, we've got them acclimated to this lifestyle, going to school. That's their routine and their pattern. Do you think something like the pandemic could have kind of threw a monkey wrench into that
to
whole thing?
disrupt it?
Yes, kind of
'Cause
just everything shut down.
that's adaptability. I mean, for me, I did teletherapy, and us day to day, we have a routine to get up, shower, brush your teeth, go to work. And then, like, once I wasn't doing that, I didn't know what to do. I started
Yep.
doing my own artwork to cope. To be honest, I have a whole notebook that I could show you guys in like another session, like another form of art therapy for just like personal healing and awareness. Like I started doing that because I was like, oh my gosh, I need to reflect and like
Mhm.
plan a new. So yes, it was disruptive, especially like
There was one other question I saw from Paige Hall, and it says, "Hey Liz, could art therapy still be impactful through virtual sessions, or would you recommend in-person sessions instead?"
hi Paige. I know Paige is. Good question. I had mentioned that like during the pandemic, it was hard to like transition from like in person. It's possible to be impactful during virtual sessions. So like part of like a lot of things in the content why my IG isn't live right now, why my website isn't live, is because I noticed that during the pandemic I was thrown off. I didn't know what to do. I didn't know how to support my clients because everything was in person or on paper, right? It was physical. So I had to figure out how can I help support them through a digital means. So yes, it can be impactful if the person is familiar or likes to use like digital stuff. So like whiteboards, like there's a like Google Jamboard, like that's way to create like collages. There's ways to like use like markers and highlighters to like make artwork. You can like import shapes, right? So even though you can't draw it physically, if they don't have the materials, you can use like a digital means to help, right? In person, I would say it's always best, right? Because that's our nature is to be interactive in person, and you can help support someone better being in person. But um, it varies. It depends on the person and how they are, and if they have the support at home from others. If it's a child, if they have that support from their parent to help them, then it can be just as impactful and beneficial as if they were in the session with me.
That was a really good question as well. Pamela J asked, "Do you find sibling involvement in the art projects helpful or distracting?"
It depends on the relationship. um, if there is like a concern with like siblings or like you know, they argue and whatnot, that dynamic. So I mentioned group dynamics. Also like two people, right? Two siblings. That's a dynamic. So you have to understand how each one of them are individually and help them adapt and adjust to be empathetic toward each other. So there's like some art projects where you can work on together, right? And I've done this in groups just so like people just like, oh, your partner next to you, you're gonna work together. So it really depends. It can be helpful if they're working toward a goal and they know. It can be distracting if like there's one sibling or one person that doesn't take any regard to what the other person is doing. Um, but if that's a goal for them to work on that, then you just gotta go with the flow and work with those challenges until they improve.
Have you worked with siblings often?
No.
No.
But so that's a good question. Because I've heard like stories or like when in the clinical setting we have like group supervision. So there's people that work with families and whatnot. My experience has been just in group settings with like 8 to 12 participants and then individuals. So that's been my experience. But I can answer that based on my peers and their experiences and
Okay.
and my approach if I was to work with siblings based on that.
Wow. I feel like you've given us such a wealth of information and knowledge on things that um I went from not knowing anything about art therapy to getting a pretty good understanding on how it works amongst the arts, autistic community. Again, I have every intention of having you back on the show so that you can talk about other ways that art therapy helps with other things. But briefly, can you tell us some of the other maybe neurodiverse situations, or things that people are going through? What other types of what can art therapy also be used for, away from just someone that's on the autism spectrum?
All right, so I'm going to ask you to go back to those slides because I have something
Yes,
that I want
ma'am.
to piggyback off to help answer that
Am I
question.
going forward or back?
Yeah, you can go for it. This, I just want to say, this is the check-in that I said, like, to have a routine. I sung a song with my groups, like the little kids, and it was like, "Hello,
You can
Fresh,
sing
hello,
with. You can
Fresh,
sing.
hello, and how are you?" And that encourages like them to like point, and the goal is to have them express how they're feeling in that moment. So like when you go into a classroom, it's good if your teacher's like, "How's everybody feeling?" Right? You don't just want to go into activity or work without a check-in. So I do that in there so you guys can, be mindful of stuff like that.
Okay.
And then this resource is if you guys want to explore like some things you can do at home. The Montessori book is for babies and toddlers. So it's really just like it lays out the developmental stages of like where a child is developmentally and like some activities that you can do at home in order to help support that development. So I would encourage this. This is right on Amazon. There's the link. But if you go to the next slide, and you see my cats here, I told you there's going to be cats. How to find a creative arts therapist. So I wanted to go into that. Actually, if you go back, I believe there's a slide before, one more. Nope, one more back. Okay, so
Oh,
I
that one.
have, yeah,
That
this
one.
one. Sorry. So there's this is for specifically for children with autism, like to help enhance communication through expression. Um, it's not specific to children with autism. That's the same thing for like a lot of kids who might be very introverted. They don't maybe there's like a traumatic experience that they had, right? So a lot of art therapists, whenever there's a crisis, a lot of art therapists are called to help because like if someone and experiences trauma, it's hard to express and process that trauma. So it enhances the communication through a nonverbal creative means, right? To improve imagination, greater thinking, relationship building, right? So if there's a child who's not socializing, it's to help with that, um, to help gain certain coping skills. So like sensory motor things like hand-eye coordination, some children or people, they might be tactile defensive. That just means that there's like certain materials that they're really sensitive to. Um, so there would be like certain materials that you would introduce to help them adapt and learn how to cope with certain textures, even food. That
Mm.
works too. Um, Enhanced spatial and like visual awareness, or just like being aware of your environment, just doing activities that helps people become aware of that, and just emotional regulation, right? So this is what's going to help people behave in a certain manner so that they're able to socially engage, so they're able to like maybe go take a walk if they need to instead of just like having a meltdown. Um, and to further elaborate on that, like there's different things that art therapy can be used for. It can be used for grief, so there's grief art therapy. I've worked with a client to help her process grief. You can use art therapy in, like I said, traumatic situations. So like after like hurricanes or like, super traumatic things that just turn someone's whole life around, art therapists are called for those things. And it's not in the media, but they are. Um, what else? It 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 really depends. Like if there's someone who gravitates to art or the creative arts, whether it's dance, drama, anything, it can just help, just like with emotional healing. It can help with people who might be so in pediatric settings and hospital settings, with adults who are like in palliative care, pediatric settings like in cancer, so like pain management, dealing with existential therapy, so like people who might be on the verge of like death, or like they are diagnosed with like something where, you know, they're struggling to deal with a diagnosis that they got, just to help manage that, right? So there's a whole range of things. It really depends on the person, what their abilities are, like what they can do. Like if they can move and they gravitate to dance, maybe that's one way to help them. But art therapy can definitely be used for like grief, for emotional wellness, pain management, you name it. If you got a question, you can ask about it. It's possible.
I need an art therapist series where Jen Slayton actually explains the use of the puzzle pieces and what people that live with autism felt about it. And so why there was an additional symbol or icon that was introduced, which is the ribbon that is multicolored, the infinity sign that's multicolored. And I do believe there's another one that's like a gold infinity sign as well. So, you know, when I learn better, I do better. And so I just wanted to pass that little information on to everybody. That's why I said drop the hearts with multiple colors, because I try to be sensitive to everyone. So I learned something. You guys learned something. Yep. So thank you again to you, Liz. Thank you to Miss Callie. Thank you to Dr. Emmy. Thank you to Jen Slayton. I appreciate all of you ladies for hitting this panel and discussing this topic. Liz, I'm going to let you go.
All right. Thank you for having me.
Again, thank you so much for being here. And don't let this be the last.
Rock bottle on the track, boy. Yeah. Lady fresh, keep it real, and that's a fact. She gon' tell it like it is, that's just that on that. Yeah, that's just that on that. This the fresh perspective with Lady Fresh. Lady Fresh, keep it real, and that's a fact. She gon' tell it like it is, that's just that on that. Yeah, that's just that on that. Tune in every week, rockin' with Lady Fresh.